So in February, I woke up one morning with a stiff neck, which isn't that big a deal. I wake up with stiff necks all the time, but this time was slightly different. It just didn't want to go away. So I made an appointment with a chiropractor, which have brought much relief. The problem is I had to go every couple of weeks because it just wouldn't go away. Then I started noticing as I press in the back of my neck where the sore muscles are, there are these little lumps. It turns out to be lymph nodes, and they're getting a little bit bigger, and not sore at all, but just a little bit bigger. Then a few months later, I decided to go see the doctor. And he examined me and said, you probably have a viral bacterial infection. We'll do a few blood tests and then just see maybe it goes away by itself. So we did that. Blood test came back normal, no problem at all. So I went on my merry way. Then in about July, I started noticing there are more of them, and they're coming back and they are getting bigger and bigger. So I went back to the doctor. Again, full physical examination, then some blood tests. This time there was a problem. So I got called a few days after the blood test, and the doctor said, look, the lab has seen a problem in your blood, and they would like to repeat the same test a week later, the next Monday, which we then did. The very next day I got a call at about 3:30 in the afternoon asking if I could please immediately come to the lab. They need to draw some more blood for specialized tests in Cape Town, because in Namibia they can't test what they need to see. But that's all they told me, nothing else. So I went to the pathology lab, and luckily the pathologist doctor came down to talk to me, and she explained, she said, look, you've got this thing called lymphocytes in your blood, and there's a lot of them. What we now need to determine is, are they healthy lymphocyte cells or are they cancerous? And then the longest week of waiting of my life started.
1 week later,
I got a call from the doctor's office saying we need to come and see him at the end of the day, and it's advisable for me to bring my wife with me. Talk about framing bad news. So immediately we knew something is not right. Went to the doctor and he said, look, there is a problem. You definitely have cancer. The thing we're not sure of is it lymph cancer or is it leukemia? And we need to do some further tests on that. And as he broke the news, my wife immediately cracked a joke.
My zodiac sign is Cancer. What a ripoff.
Turns out that's our coping mechanism. At least the doctor made a comment and saying that he's relieved we are so positive. It's not great news, but we'd rather laugh than cry, kind of thing. So he then said all the arrangements have been made for me to go into theatre on the Wednesday to remove a lymph node, which I still got the scar on my neck, as you can see, and then also to do a bone marrow biopsy to figure out exactly what kind of cancer this is and what the way forward will be. And by the way, we were told this is a very small procedure. It's normally you go in the morning, you go home in the afternoon. It's really nothing to be worried about. You have a small incision and a small drill hole where they take out the bone marrow. Turned out, wasn't true. When I woke up, I had a massive cut in my neck, as you can see there, with a drainage pump and tube coming out of it. I sort of knew this wasn't going to be a same day going home kind of thing. So the surgeon came to see us and said, look, maybe tomorrow you can go home, but tonight you have to spend in the hospital. And I hate spending time in hospitals, but I survived it and we got discharged. Then the next Monday, we were told that I've got something called CLL, chronic lymphocytic leukemia. So basically means I've got leukemia in my bone marrow and the cancer cells have spread to my lymph nodes. But normally and luckily, this is a slow kind of cancer. In many cases, it doesn't need treatment at all for either immediately or for years or sometimes never. But there is a twist.